and welcome to the Microbeworld. Today we'll be learning about one of the most common and important bacteria known as Escherichia coli. Commonly it is called E. coli. In this session, we will do a little introduction of this bacteria and learn about its morphology and clinical significance. So let's start. Coli is a most common and clinically important bacterium. It is a normal gut flora of human and warm-blooded animals. It also helps in digestion. Do you know what is normal flora? Normal flora denotes the population of microorganisms that are normally harmless and inhabits the skin and mucous membrane of healthy normal person, and they even may be beneficial. E. coli was discovered by a German pediatrician Theodor Escherichia in 1885. Later the genus Escherichia was named in his honor, combined with coli. It was first isolated from feces of an infant suffering from diarrhea. Now let's move into morphology. Morphology is important for preliminary identification of any bacteria. Bacteria are generally classified into two groups, gram-positive bacteria and gram-negative bacteria, and this classification is based on the physical and chemical properties of the cell wall of bacteria. E. coli is gram-negative bacteria. It is a rod-shaped bacteria. It measures about 1 to 3 micrometer in diameter. It may occur single or in pairs. It is a non-spore forming bacteria. It is motile, while some strains may be non-motile. In some strains, capsule and fimbriae are also present. Clinical significance. Two main types of clinical syndromes are caused by E. coli. They are intestinal disease and extraintestinal disease. First, intestinal disease. Here are at least 5 types of pathogenic E. coli that cause intestinal disease. And all these are basically the same organism, differing only by the acquisition of specific pathogenic traits. They are enterotoxigenic E. coli, enteropathogenic E. coli, enterohemorrhagic E. coli, enteroinvasive E. coli, and enteroaggregative E. coli. Enterotoxigenic E. coli. It includes the strains of the E. coli that causes diarrhea by producing toxins. The site of action is small intestine. It causes traveler's diarrhea, which refers to acute diarrhea that develops during or shortly after travel, especially when individuals from developed countries travel to one of the developing countries. It is characterized by nausea, vomiting, watery diarrhea, and often associated with low-grade fever. It also causes secretory diarrhea in infants in developing countries. Infection is acquired by ingestion of fecally contaminated food or water or by person-to-person contact. Common serogroups include O6, O8, O25, O63, O78, O148, etc. Enteropathogenic E. coli. The site of action is small intestine. It causes diarrhea in infants and children, characterized by vomiting, nausea, and non-bloody stools. It is an important cause of pediatric diarrhea, most frequent in children in developing countries with poor sanitation. The disease is rarely seen in older children and adults, presumably due to production of protective antibody. Common serogroups involved include O26, O55, O86, O11, O19, etc. ETEC diarrhea occurs usually as institutional outbreaks in infants and children. Enterohemorrhagic E. coli. The site of action is large intestine. It is characterized by watery stool which is followed by grossly bloody diarrhea known as hemorrhagic colitis with severe abdominal cramps. Most cases occurs in children under 5 years. EHEC strain is also associated with life-threatening acute renal failure known as hemorrhagic uremic syndrome. Cattle and young calves serve as the primary reservoir of EHEC. The typical EHEC is serotype O157H7. Enteroinvasive E. coli. The site of action is large intestine. It invades and destroys colonic epithelium. The symptoms range from mild diarrhea to frank dysentery with blood and leukocytes in stool specimens. The disease occurs in children and adults and is primarily seen in developing countries. Common serogroup includes O28AC, O112AC, O124, etc. Now talking about the extraintestinal disease caused by E. coli are urinary tract infection, septicemia and pyogenic infection, neonatal meningitis, nosocomial infection. If you want more detail about extraintestinal disease, then mention.